folks, welcome to week 11. We are moving on to evidence-based practice this week. And as I'm sure you know, evidence-based practice, evidence-based research, is really a problem-solving approach for clinical decision-making in healthcare. And it's a three-legged stool, if you haven't heard this before, and it always integrates the best scientific evidence that you can find with practitioner experience, nursing experience, and patient preference, definitely what's going to work for each individual patient. And it allows practitioners to assess research and find the highest quality findings and apply them to their patients. And one of the reasons that we focus on evidence-based research is, of course, because we want to build a body of scientific knowledge to base our nursing practice on. But journal articles are much more up to date than anything a textbook would be. By the time a textbook gets to print, its information is about 7 to 10 years old. So it's already pretty much out of date, and that's kind of scary. But with journal articles, you can usually get new evidence out in a year to 2 years at the most. So that's why there's this focus now on searching journals and finding out what people have done and seeing what's the best and trying it out and assessing it for yourself. So our learning objectives for this week are to evaluate evidence and discuss approaches to integrating evidence into practice. And this is a PowerPoint about forming a PICO question. And this is a template for actually making a PICO question, which you'll be doing in your discussion board this week. And PICO is an anagram for all the elements of a searchable question. And you have your patient population, your intervention, your comparison, and then your outcome, what you're looking to see. Time is sometimes in here, but that's always optional. A lot of the things that we want to look at, we don't have time to spend a couple of years looking at them. So these are templates for different types of PICO questions. Here are some definitions, so you know what the types mean, and then they give you some sample questions here. So I hope that's helpful to you. And down here is a link to Sigma Theta Tau International. This is the International Honor Society for Nursing, and it was founded in Indianapolis, Indiana, actually. It has a large membership. If you're a VCU or another grad from another school, you may be a member of Sigma Theta Tau. Here at Bon Secours, we're working towards becoming a Sigma Theta Tau branch. We have an honor society now, which you as RN to BSN grads are welcome to join. And we have a nice ceremony at the end of the semester right before graduation. And as soon as we get enough membership, then we'll be able to be a division of Sigma Theta Tau. So if you go to the link and it's their website, look at why STTI, then about, and read their mission and values and vision. It's pretty interesting. You get a feel for what kind of an organization this is. The 4 articles we've assigned you to read, well, there is a chapter in the book, but the 4 articles are the Fine-Out Overholt articles, and those 2 women are like the dean of evidence-based practice. And these articles are probably beyond the 5 years, but they're definitely the seminal articles about conducting evidence-based research and about how to form a PICO question. So I hope that's some helpful reading to you. And what do we have here? Oh, a little video about evidence-based practice. And then we're going to start talking about the annotated bibliography. What's going to happen this week is, in your Blackboard, you're asked to write a PICO question about something that interests you in your practice, something you'd like to find out something more about. Then, next week, you're going to write an annotated bibliography. You're going to find 5 journal articles and write an annotated bibliography and turn it in. I think it's due on the 5th. It's due in 2 weeks. So this is a PowerPoint about the annotated bibliography, and this is an example. 1, and notice it's APA running head, page numbers, and you start with the title. And remember, each annotation is begun with a hanging indent. It's kind of backwards from what you usually do. When you talk about the authors, you need to give the qualifications. So these are physicians who reviewed multiple clinical trials, and this tells more about their physicians in Australia and such on. There should be 5 articles. You don't have to have a reference page at the end of this. Now, this is a very prescriptive type of assignment, so it's really not that hard. I've linked you to the APA writing resources, and also to, here's the Purdue OWL. If you type in annotated bibliography, they'll give you more information on that. And this is what I'm after. Submit your annotated bibliography is right here. Okay, you research your question, 5 journal articles related to your question. They must come from scholarly, peer-reviewed journals. No websites. I know there are good websites. You can go to, Cleveland Clinic and Mayo Clinic and all that, but that's not what we're looking for. We're looking for journal articles on some type of research that's been conducted. They should be no more than 5 to 7 years, unless you find something that's a seminal article. And you have to address all 6 points that are in the rubric. And we can go right here, and I will show you the rubric. Okay, so 5 articles, that's pretty easy. This is where people start to lose points right away. In every article, every annotation, you have to include qualifications of the author. Are they, researchers in this particular line, or are they physicians or nurses in this particular area of medicine? You want to tell them the purpose of the article, how this article relates to the other articles that you've pulled, the standpoint of the author, audience for whom the article is written. Is it written for lay people, for nurses, physicians? And then summarize the content. You have to have all 6 steps in here. For each step you leave out, you're going to lose 2 points. And that's 2 points on each article that you leave it out of. So you can lose a lot of points fast, and I hate to see it, but it's just very, very, rote. Also, use good APA. And here's where you submit it. I hope I have given you a good overview of what's expected. And if you have any questions, please get in contact with me. I'm more than happy to help you. So look for a good PICO question, post it in Blackboard, and give each other feedback, and I'll be giving you feedback too on your question. And from there you can start on your annotated bibliography and get that written, and you'll be well on your way. I've gotten all of your imaging nursing papers, and it's probably going to take me at least a week to get to all of them because I have an onslaught from my pre-licensure class too, but I'm really trying to get through them. And otherwise, have a good week, and I will talk to you another week. So take care.